How is isoniazid dosage adjusted for TB patients? When it comes to treating tuberculosis, or TB, one of the key medications used is isoniazid. You might wonder how the dosage of this important drug is adjusted for patients. The answer lies in several factors, primarily the patient's weight and their overall clinical condition. For both children and adults, the isoniazid dose is calculated based on body weight. This approach helps ensure that the medication is effective while minimizing the risk of side effects. Typically, the daily dose is around 5 milligrams per kilogram of body weight, with a maximum limit of 300 milligrams per day for most patients. In some cases, patients may follow an intermittent dosing schedule, meaning they take the medication 2 or 3 times a week. For these schedules, higher doses of 15 to 20 milligrams per kilogram can be used, with a maximum of 900 milligrams per dose. It is important to weigh patients at the start of treatment, weekly until their weight stabilizes, and then monthly thereafter. This way, healthcare providers can adjust the dosage as needed based on any changes in weight. The treatment for TB is divided into phases. During the intensive phase, which usually lasts for the first 2 months, isoniazid is given daily or 5 to 7 days a week. After this, in the continuation phase, which typically lasts 4 months, the frequency of dosing may be reduced to 2 or 3 times a week. This phase often involves directly observed therapy, where a healthcare provider ensures that the patient takes their medication as prescribed. For patients with extrapulmonary TB, which affects parts of the body outside the lungs, treatment durations can be longer, ranging from 6 to 12 months, while still following the same weight-based dosing guidelines. Certain populations may require special considerations. For instance, patients who are at risk for neuropathy, such as pregnant women or those with conditions like HIV, diabetes, or malnutrition, should receive pyridoxine or vitamin B6 to help prevent nerve damage caused by isoniazid. If a patient develops peripheral neuropathy, the dose of pyridoxine may need to be increased. Interestingly, no dose adjustment is typically needed for patients with renal impairment, but it is crucial to monitor their clinical condition closely. If a patient has cavitary disease and still tests positive for TB after 2 months, they may need an extended continuation phase of treatment. When taking isoniazid, it is best to do so on an empty stomach to enhance absorption. For patients who cannot take oral medication, intramuscular formulations are available. In summary, adjusting isoniazid dosage for TB patients involves careful consideration of body weight, the phase of treatment, and individual patient factors. Close monitoring and adjustments are vital to achieve the best treatment outcomes while minimizing potential side effects. Always consult with a healthcare professional for personalized medical advice.